Mangione, shackled and cuffed, read from a paper as he described to the court his debilitating back pain and frustration with the health insurance system that he said led him to target the United Healthcare CEO at an investor conference, saying he emailed United Healthcare leadership posing as an investor to gain access to the conference. I used a 3D printer to make part of a gun, and I equipped the gun with a silencer and magazine. On the morning of December 4th, 2024, I shot Mr. Thompson in Manhattan and he died.
I am Chris McCain, the Prince of Policies, and I'm here to help you understand the insurance policies that protect your health, your family, and your retirement. Now, you've probably seen the story all over the news. The Louisiana, whatever his name, he admitted in federal court that he deleted Brian Thomas, the CEO of healthcare. And this case has generated an enormous amount of discussion about American health insurance system, and specifically insurance claims denials. But today I'm not here to debate the case. I'm not here to justify it, and I'm certainly not here to glorify it. I am an insurance professional, so what I want to do is do something different. I want to take a step back and answer a question that millions of people have asked. Why does an insurance company deny a claim? First, let's separate the facts from assumptions. However, say his name, Mangione, has publicly described frustration involving his health problems and insurance experiences. But we should not tell people that a specific United Healthcare claim was denied and that this directly caused the deleting of the United Healthcare. Healthcare has said that Mangione was not one of its members. So this is an important distinction. However, his case brought something else into the spotlight. The public frustration with health insurance claims denials. And that's what I want to explain. Let's make this simple. You go to your doctor recommends a treatment, procedure, medication or service or claim. The claim or authorized request through the insurance process, and eventually you get one or two basic outcomes, approved or denied. Now, I have a diagram so I can show you exactly what that will look like. But there is a problem when people hear the words deny. They often assume the insurance company is saying, we're not going to pay this because we don't want to. That's not necessarily what happens. There can be several different reasons for a denial. Number one, not covered. The service may not be covered under the plan. This is one of the most important things people need to understand about insurance. Your doctor can recommend something that doesn't not automatically mean your insurance policy covers it. Your doctor is dealing with your medical care. Your insurance plan is dealing with what the policy covers. So those are two different questions. So in other words, you gotta look at what your policy covers. So let's say your doctor recommends a particular treatment. The patient says, well, my doctor said I need it. So insurance has to pay for it, not necessarily. The next question is, does your particular insurance plan cover that service? That's where the policy comes in. Number 2, prior authorization. This is a big one. Some health plans require the insurance company to review certain treatments or medications before they provide. So I'm going to say that again. Sometimes they need prior authorization or treatment or medication before they provide. So your doctor might say you need a treatment, but the insurance company may say, before this treatment is covered, we need additional information. And this is where things can become frustrating for patients because from the patient's perspective, the doctor already told me what I need, but the insurance company may have different criteria or process that requires certain information before authorization is granted. That's why it's important to know whether you're dealing with a claim denial or a prior authorization denial. Those are not necessarily the same thing. Number 3, medical necessity. This is probably one of the most controversial areas. The doctor may believe a treatment is appropriate, but the insurer may determine that the service does not meet its medical necessity criteria under the plan. Now, you have a disagreement. The patient says, well, my doctor says I need this. The company says, well, based on the information we received and the criteria we require to, we don't believe this service qualifies for coverage. And that's where the appeal process can become extremely helpful. I'll say that again. And that's where the appeal process can become extremely important. Number 4, documentation. Sometimes this issue isn't necessarily the patient's. This issue isn't necessarily that the patient doesn't need the service. The insurance company may have received the information it needs to process the claim. Maybe medical records were missing. Maybe the claim was submitted incorrectly. Maybe information wasn't undocumented properly. Maybe the provider needs to submit additional information. And that's why I tell people, don't just look at the words denied. Look at the reason for the denial. Number 5, network or plan rules. Depending on the type of health plan you have, where you receive your care can matter. You may have different levels of coverage depending on whether provider is in network or out of network. And some plans have specific rules about referrals, authorizations, or where the service can be obtained. What I really want you to understand, a claim being denied does not necessarily mean the story is over. Depending on the situation and the type of plan that may be an appeal process. And that's why you should never simply see the words denied and give up. Find out, why was it denied? What does the explanation of benefits denied notice say? What information was used to take the decision? Is additional documentation needed? Can the decision be appealed? What is the deadline? Those questions matter. And this is where I think the national conversation gets complicated. On one side, you have patients who say, I'm paying my premiums, I need medical care, why isn't my insurance paying for it? On the other side, the insurance companies argue that they have to determine whether the service meets the terms of the plan and applicable coverage criteria, which means does the service fit the plan that you got? And there has been significant scrutiny on insurance companies, prioritizations and denials and practices. So this isn't simple black and white. And that's exactly why I created insurance case files. I'm not here to tell you that insurance companies are always right. I'm not here to tell you that they're always wrong. I'm here to break down what had actually happened. So when you see a headline of an insurance company claim denial, I want you to start asking a different question. Not, why won't they pay? But, why was it denied? Because that's where the real story begins. And if you're watching this and thinking, wait a minute, I have an insurance policy and I don't even know what it actually covers, that's something that you should probably find out before you need to file a claim. If you're looking for help reviewing your insurance options or getting a quote, I'll put my information in the description below. More real insurance cases broken down like this, subscribe to my channel. This is Insurance Case Files, where we're going to look at real cases involving life insurance, Medicare, health, auto insurance, home insurance, and insurance fraud. We're going to look at the headline. We're going to look at what actually happened, and then we're going to break down the insurance behind the story. Because sometimes the headline tells you what happened, but understanding the insurance tells you why. I'm Chris McCain, your Prince of Policies, and this is Insurance Case Files. Real cases, real claims, real lessons. I'll see you on the next case.